This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we'll be discussing considerations for safety when working with 5-MeO-DMT with Joël Brierre. Joël is the founder and CEO of the retreat company Tandava Retreats, as well as co-founder of the 5-MeO-DMT education and training platform F.I.V.E. With decades of combined experience in psychedelic work, Joël and his team are focused on shepherding 5-MeO into the world in a safe and effective manner. Now, before we get to our chat with Joël, just a reminder that everything here on the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one last reminder, if you are a clinician and this talk about safety has piqued your interest and you would like to learn more, please check out the Psychedelic Medicine Association. It is our mission to educate clinicians on 5-MeO-DMT and all the other psychedelics. So please check us out at psychedelicmedicineassociation.org. Now, without further ado, thanks for joining us today, Joël.
Thank you so much for having me on. Good to see you.
I'm stoked. If you have not heard our last conversation, Joël and I had a chat on the podcast maybe 2 years ago at this point. It is one of the most important chats we've had. We were discussing how to choose a psychedelic retreat center. And I think that, since that time, the retreat space has kind of exploded. And has the safety caught up with it? Questionable. And so I'm always good to make sure that when you are checking out a retreat, go back and listen to that episode. Pay really close attention to a lot of the things that Joël and I discussed. I think it's really important. And I'm sure this conversation you and I are about to have is going to be just as important. So Joël, let's start. First off, you all have been working with 5-MeO-DMT for a long time. I know you've seen a number of scenarios, probably from the mental and physical health sides of what, challenges can come up with this medicine. And so I was really happy that we could have this conversation because there aren't, first off, the research in all this is in its infancy and most of it is done on people who have a very specific, maybe kind of monodiagnosis, right? Like here, we know that you have depression or you have PTSD, but you probably don't. You've probably been excluded if you have these other mental illnesses, maybe bipolar, psychosis, other things. And then they're often done on people that are pretty medically uncomplicated, right? They don't have a lot of things in their personal medical history. And so there isn't necessarily a lot known. And so I think it's really important that you all in your education program have started to put out things about safety when working with 5-MeO-DMT. So can you talk a little bit about what inspired you all to go down this route?
Absolutely. Yeah. Thank you. What inspired us was a desperate need for sanity within the 5-MeO community. There was a lot of people being harmed by their experiences and a lot of people being traumatized by their experiences, particularly, hitting a peak around 2016 to 2018 with two notable practitioners out of Mexico serving very high doses of Bufo all around the world with no screening or intake protocols. And so that was when we started to see a very unfortunate amount of people or of big injuries and incidents occurring and even deaths due to, whether it be contraindicated medications, due to psychological conditions that can be exacerbated by this experience, due to simply not checking that they had uncontrolled high blood pressure. Things like this that could have been very easily mitigated if there was some sort of centralized hub of understanding and knowledge on this molecule. Hence, out of a desperate need for sanity, F.I.V.E. was birthed. And it was actually the brainchild of my amazing partner, Victoria Wushner. And, our first idea was to make sure that it wasn't just about us. We know what we know, but we don't know everything. So we reached out to everyone that we trusted and respected in the 5-MeO community, from people who are spiritual teachers to pharmacologists and clinicians, to get a fully well-rounded understanding of this beast of a molecule and its ineffable experience.
Yeah, I appreciate that. I love seeing some of our familiar names on there. I think you had Joseph Barsulia as one of your
Absolutely.
advisors. Yes, I think he might have even done our 5-MeO-DMT science episode way back in 2020. So love seeing that. And for pharmacology, do you have Ben?
Sure do.
Was it?
Sure
Ah,
do.
Ben
No,
Malcolm.
no other than the spirit
No other,
pharmacist.
right?
Yeah.
Yes. The spirit pharmacist who we've had on this
Hmm.
show a number of times. He is on the Psychedelic Medicine Association board, one of my favorite people.
Hmm.
So you got some legends there contributing
Yeah.
information. Now, I guess this would be more a question for them, but just in case you happen to know, like as I was mentioning before, like without a lot of research being done on specific populations, do you know how, did they kind of just have to extrapolate safety guidelines from what little has been researched? And maybe also
Un-
just some anecdotal incidents that have compiled?
Exactly. Exactly. It's yeah, there's not a lot out there right now. There's a few published studies. There's been a lot of anecdotal reports, and there's been a lot of kind of research papers done via survey and stuff. But there's just so many factors that go into it. Right now we're partnered with UCL for an upcoming study that'll be happening down here at the Tandava Center, and just on this one we're just going for basic information, basic data catching on the peak 4 to 6 minutes via neural imaging with a 32 point EEG. And there's so many different directions that we can go in there, but there's so many different things that can get tricky. 5-MeO-DMT is a psychedelic of many paradoxes, and just as as we observe under a microscope, the closer and closer we look into physical reality, the less tangible and solid it becomes. Same thing with 5-MeO-DMT experience. The more we look into what's really, really happening, the less we really understand about life in general. But it seems to do something, and right now, I think it's really of utmost importance that safety parameters are out there and getting an understanding of different conditions that could really, really be either exacerbated or groups of people that can be harmed for this. I think there's been a lot of lofty headlines going out, over the past few years, promising a cure to depression and anxiety from, an inhalation of this smoke. However, we can have a very beautiful experience on 5-MeO, but I may be in an amazing glow for 4 to 6 weeks, but life is going to come back at me at some point. My patternings are going to come back. Those parts, those protector parts that may have laid down for a little while, they still haven't been heard. They're going to come back up and regain control. There's a lot of different things to go into it. So it's very important to us that it's kind of shepherded out into the world in a safe and effective way with a good understanding of how it can go wrong, because another bad headline can really harm the progress that it is seeing.
Yeah, absolutely. And I'm always so appreciative when people keep an eye towards that, is that there's so many people are moving towards progressing and then one bad headline can undo it all. And so that's why harm reduction is so important. Every safety measure we
Yeah.
can take. Um,
Mhm.
before we get into the information that you all are putting out, I just wanted to ask about, you said you're doing a study with University College London, which is very exciting.
Yes.
You said they're going to be wearing an EEG cap while they're doing the five.
Oh, yeah. So we are taking 32 healthy volunteers, all who have been experienced already in 5-MeO-DMT, are not going through a significant, or are not in the midst of a significant healing process, um, and are also known to be what we would classify as a Buddha sitter. And a Buddha sitter is a nickname adapted from the Temple of Awakened Divinity, whose container was used in the Oxford surveys, I believe, in 2019, around, I believe it was looking for amount of participants reporting a mystical experience in a well held setting or something like that. The Temple of Awakened Divinity was known to kind of have that perfect, just very, very, very solid, well held container where everything is thought of. And so a Buddha sitter is someone who essentially stays very still during their experience. And if someone stays very, very still, then there's going to be less artifacts in those neural imaging and more information to be drawn from. So it's going to be interesting, clean data on that peak mystical experience, especially when someone goes fully non-dual, has never really been captured. So the inner psychonaut and the consciousness explorer in me is very, very excited.
Yeah, and I like how you read my mind because I was like, "Who is gonna keep that hat on?" A Buddha sitter. There you
Yep.
go. Very
Yep.
nice, very nice. Well, so speaking of, let's get started since we're already on that kind of medical front.
Hmm.
What kind of, medical considerations from, let's start with physical medicine. Like you had mentioned something like hypertension. If you could talk a little bit about some of those physical medical considerations when screening patients for 5-MeO-DMT.
Yeah, some things we may look out for, particularly issues with the central nervous system. multiple sclerosis. Multiple sclerosis can be re-triggered by working with 5-MeO-DMT theoretically. And so let's say someone has been in remission for 15 years. This could still technically um, bring it up and trigger it. We had an experience last year with a participant who, in their screening form, this came up, and she had been in remission for 15 years. We let her know that it was a possibility of it being triggered, but it was only theoretical. There has been no reports of this happening. I believe it was 2 days after her first experience, she started getting some initial symptoms of it coming up. Luckily, nothing ever happened. And it seemed to have brought up a kind of cathartic release around a lot of the different psychological wounds around going through it as a teenager. But it was definitely a good, scary experience for us, and now something that we do disclose, and we let people know if they're working with it. We let them know that we have had a participant who did have these symptoms come up. Nothing further occurred, and it's now been about a year and a half. But these things can happen. If someone has a history of epilepsy, this can absolutely trigger a seizure. There's a lot of, not a lot, but there's certain things that we just wouldn't want to put to risk. If someone has recently gone through a surgery, we want to make sure that there's no chance, if they are to become physically dynamic, that there's no chance of them becoming injured and that injury being a lot worse than it could. If there is heart problems is really the main one with 5-MeO-DMT, and they're going to be a lot more risky with Bufo, because Bufo definitely has greater cardiotoxic elements, which is one of the many reasons why we only work with synthetic here at Tandava. But let's say someone has unregulated high blood pressure. This could, there is a pretty instant spike to blood pressure in this experience. There is a pretty instant constriction in the heart valves. There could be some complications there. So there have been heart attacks in session. All the ones that I've heard about have been with Bufo. And so these are all things that we screen for. If there are ever any questions, we get them to check with their primary care physician. We let them know. We'll get them any research, anything on any information that their PCP needs. But that's not a decision we're going to make for them.
Sorry for everybody that there is a trash truck in the background and there's nothing I can do about it, but that's the beeping. That's an incredible amount of information, and it's brought up a lot of secondary questions. So when you talked about the theoretical chance with MS, what is behind that theory? Like how do whoever knows this, how do they know that that whatever 5 does has a potential to reflare symptoms?
Great question. And I'm going to explain it in the limited way that I can understand it, as I am not a medical professional myself. But as it was explained to me, something around it's not that just that the molecule itself can trigger it, but more so the extremity of the experience can trigger it. Something about an extreme experience where even a car accident could technically re-trigger it. This could be viewed by the mind as something similarly as traumatic in some cases. And so that's how it was explained to me.
That makes total sense. And is that the same with epilepsy? The same reason that it may trigger a seizure?
I'm not sure if there was another thing in there, that if there was another component, but I know that is a component. That was also part of how it was explained, but there may have been another aspect as well. But I wouldn't be able to speak to that.
Okay, totally fine. Something we can follow
Mm,
up on next on
yeah.
the 15th time I have Ben on the episode. And then I love that because I had literally written, again, you read my mind. I wrote Bufo versus synthetic in my notes before
Hmm.
you even said it, and then you pointed out that there are differences in the risk. And I guess just on a kind of basic level, I don't know that much about how synthetic is made. Like, what is different? I just naively assumed that the synthetic was really close to the same chemical structure, so they would have the same, say, like you said, cardiotoxicity.
Hmm.
Do you know what's different about it? I mean, again, this is a
Yeah.
nitty gritty question, but
No, it's perfect. So 5-MeO-DMT itself does not have the cardiotoxic elements, but keeping in mind that the Bufo secretion is only 10 to 30% 5-MeO-DMT, and then that's another 90 or 70 to 90% of, there's 12 additional alkaloids present. They're all in trace amounts, but some known to be cardiotoxic, as well as the presence of bufotenine, which can be, was it cardioconstrictive? Oh, I can't remember for the life of me right now, but bufotenine does pose the extra risk.
Interesting. Okay. This, you know, what, you and I could just have another whole episode on Bufo versus synthetic. Okay. Right. We're signing
Yes.
us up for that. Okay. Fantastic. Can't wait.
Mhm,
All right. Well, that's a great start. I really appreciate you getting us into this with the physical considerations.
mhm.
Let's talk kind of general. Let's say we'll get into trauma specifically in a bit, but what are some general mental health considerations when screening somebody for 5-MeO?
Mental health considerations, things that would be more red flags would be, the dark triad, bipolar disorder would be definitely one, and there are people who are working with 5-MeO. I do know at least two underground practitioners that I can think of that are mental health professionals and are working with people with bipolar disorder successfully with 5-MeO DMT. That being said, these are very seasoned practitioners who both of I know who have been serving underground for over 2 decades, and have been mental health professionals for decades longer. I would not say myself or anyone on our team would feel safe around getting into that right now. At a further date, it's something we would love to do. It sounds amazing, but it's, from what I can understand, an extremely involved process. And extreme, these are practitioners that see, one, client per month, with this type of work, around working with this molecule and that type of thing. So definitely not something we would look to tackle. Definitely something that can be very problematic. Narcissism can be inflamed greatly, with especially if it's going to take a pretty skilled integration specialist to help navigate the shit show that can likely bring up. And we're really not too intrigued on trying to tackle that just yet. Um, there are other ones,
What about
there's a
borderline
lot of
personality disorder? Because I think that's
BPD, absolutely, absolutely. BPD could 100% become inflamed. It could get real ugly with BPD, and it's tricky because BPD is often misdiagnosed, um, where it is where they diagnose it as or it's misdiagnosed complex PTSD. Very very often that can get tricky because we've had a lot of success working with people with CPTSD. Um, BPD is something that I've worked with maybe one or two people with years ago. Not something that we're willing to tackle right now. We have other colleagues who have had some pretty bad experiences working with people with borderline personality disorder. Just does not seem to be again, it's going to be heavily reliant on someone with extravagant skill sets and time and space to be able to really dive in there with a person to get that deep to be able to have some positive effect and to mitigate damage. But as I said, complex PTSD, we do work with that quite often. The kind of deciding factor in there is the level of neurosis. Um, that's a big one. Extreme neurosis can really become exacerbated, and it can become really problematic in the integration process. And some turbulence needs to be expected during the integration process with 5. Even in a beautifully perfect container with blissful experiences, things need to come up. But with a certain level of neurosis, we've seen it get really, really tricky, and it's put some of our integration specialists through to the test. But it's wonderful, and we see great results. But um, there are definitely some times where we see people get in the way of their own process, because of things where we perhaps could have either brought in extra help or perhaps should have referred them onto a different practice.
yeah. And I just want to make clear that we are not trying to throw shade at any of these diagnoses or anybody with any of
Yes.
these diagnoses. I think what is good to highlight at this point is that a lot of 5-MeO DMT is done in retreat settings. And, as you have down there. And what you were talking about was that sometimes these higher acuity diagnoses require more of a one-on-one setting.
Yeah.
And like you said, with somebody who, in addition to being trained as a psychedelic practitioner, 5-MeO facilitator, is also trained as a mental health clinician, and
Hmm.
that's a great combination. So, when a lot of times when we talk about things being, contraindicated, meaning that we don't advise you take this medicine. We may be saying we don't advise you take this medicine in this certain setting, or with just any practitioner. Maybe, we're never
Exactly.
saying that this is like out of the realm of possibility. I think there's
Hmm.
it will probably then let me know if you agree with this, is that if somebody, let's say, has borderline personality disorder, but well treated, has been diagnosed with it, has been well treated, like the symptoms are, at, let's say, well managed, then
Hmm.
I can see where the risk would be a flare up, as
Yeah.
opposed to the risk being that the symptoms are going to make um, them getting any benefit out of it impossible, kind of thing.
Yeah, absolutely. And having an integration specialist that is intimately familiar with borderline personality disorder and the 5-MeO process really helps. We had a participant last month who has a BPD diagnosis. He feels, and his specialist that he's been working with for a while feel that it is a misdiagnosis, but we definitely saw some things that hint towards BPD, and it was a very challenging container, very challenging, but was fruitful and it was beautiful, and we did see a really nice turnaround after about a month post experience. Um, that being said, would we be fully open to take that risk every time? I would say it's a case to case basis a lot, and that's really just like you said, depending on kind of how much they've really worked into it, how the symptoms were showing up, if and when, and how supported they are if a flare up were to happen. Because we can provide them with a great specialist, but we want them to already have some sort of support system. Either a specialist that they have a great relationship that they're working with, or making sure that their family or whoever they're living with has an understanding and compassion for this, etc. And just making sure that they're well supported and not going into a place to where if it does flare up, it could really destabilize them into a bad situation.
Yeah, absolutely. And I'm just going to go down this road because I'm dying of curiosity. The narcissism. So, are you saying you don't like, I mean, in all of my years of practicing medicine, I don't think anybody ever showed up to my door with an actual diagnosis of narcissistic personality
Hmm.
disorder. Um, is so is it a case of and I'm sorry that I'm just like so amused at that, like picturing how this intake goes, but is it if somebody is displaying narcissistic tendencies that you said that you think like maybe this is not the retreat center for you, or do they have to come with a diagnosis? Can you, because excuse me, we do know that people very often come to F.I.V.E after doing other psychedelics, and we also know
Yeah.
that psychedelic narcissism is a thing.
Oh yeah.
See the episode we did with Adam Adonovich. But so
Yes.
from healing. um but I can imagine plenty of people come to you and they're like, oh, the medicine told me this or that, and delusions of psychedelic
Yeah.
narcissism grandeur. What's kind of like, how do you suss that out as to whether it's like, oh, just they're having a little day where they like to talk about themselves a lot, or this is like a level of narcissism that is going to be prohibitive?
Luckily, it's actually not something we've had to deal with yet. And kind of it's based on kind of anecdotal data from colleagues and different groups that we work with. You know, yeah, like you said, it's something that's on the screening form. Have you ever received a diagnosis of et cetera, et cetera, et cetera? It's not something we've ever had anyone check a yes on. Um, Luckily, with our participant group and our demographic, psychedelic narcissism is not one that really makes it our way because I would say 90 to 95% of our participants are complete rookies to psychedelics. Most of them are first timers, and most of them have never even smoked cannabis. And we are an anomaly amongst our colleagues, though. Out of anyone I can think of and spoken with, we're the only ones, except for one other group, that are getting mostly first timers right now, and it's I love it. There's where we used to feel that you really had to work your way up to five. We found with the right amount of prep and with good individualized approach, it's right for anyone as long as they're in the right place for it. So if they make it through the screening and intake kind of process, we're good to go. But narcissism has not shown up yet. I've heard about how it has shown up and seen how it's shown up mainly in 5-MeO practitioners with excessive use. But yeah, it's a tricky one. Luckily, we haven't had to go there yet. I don't know how we would address that. Yeah.
I mean, I just had to ask.
I love it.
Yes. Okay. So we've talked about some of the kind of more general things. What about trauma in specific? What are some safety considerations of working with patients who have significant trauma?
It depends how the trauma's showing up, how it gets triggered or how they react when it gets triggered. Let's say a combat veteran who goes into violent states when a memory surfaces. I've heard about work where this is really beautiful for them, and there are specific groups doing this work. And if it is run by vets and they're surrounded with people who get that, along with psychologists who understand that headspace, and it is a well supported container, Hell yeah, go for it. Um, are we going to take on someone who's having violent episodes if it is triggered? Most likely not. Most likely 5-MeO would not be in our opinion, the best approach with us. Um, if someone is just recently dealing with some very fresh trauma, this may not be the best thing. It's a big experience and it's a big process. Sometimes it's good to also just be with what has happened. You may not want to just go and get this done right away. It's not like it's going to cure the trauma. Um, we work with a lot of people working through childhood trauma. We work with a lot of people working through sexual trauma. Um, and I feel that each case is to be individually kind of looked at, and to see whether or not this is appropriate. My partner Victoria and Dr. Holly Richmond have teamed up to do a retreat this September on specifically for female sexual trauma survivors. And so I think that's going to be a really, really beautiful place to where women can come together and address some very, very deep wounds where it may not generally be appropriate in our regular protocol. Our regular retreat protocol, it's an individualized approach, but we take up to 6 people here at the center. Medicine sessions are done privately, and integration is done privately. You get your own integration specialist. But if, there's a female working through some heavy, heavy trauma, and we're taking them into a very vulnerable space, even having other, let's say there's a male participant who's working through anger issues and, is kind of, their process involves them screaming. That could be a potential big trigger. And so during our regular protocol, we're very kind of mindful of what kind of people we group together. And with trauma, you need to be really careful around that. I think specialized retreats are very, very useful for trauma. Bringing in specialists in those specific niches, to really make a container that's really about that, and where the participants can feel safe enough with each other to kind of go into that process with each other. Because there is something to be said to that group environment and group atmosphere. There was those 2 studies, I think 2021 and 2022, that showed there was a chartable effect of going through healing in a group environment. But of course, especially with 5-MeO, there's also going to be some downsides. So with 5, if there's trauma, it's usually going to bring it up. So it's going to depend on the level of trauma, and the severity of the reactions to it and their sensitivity. And then there may be some cases where we'll work with them, but we're not going to go higher than, say, a medium, kind of hug level dose.
Interesting. Okay, yeah, we had not discussed dosing. Can you talk a little bit
Hmm.
about how you all decide on dosing and
Yeah.
which kind of things that we've discussed might factor in?
Yeah. Dosage is, because of the fact that 5-MeO-DMT is highly unpredictable. There's an intuitive nature to dosing as well, and there's kind of 3 main realms of dosage. You have your handshake, your hug, and your full release dose. And so, I would say in pure 5-MeO-DMT terms, a handshake dose is 1 to 3 milligrams, hug dose 4 to 7 milligrams, full release 8 to 12 for first timers. Of course, you can go up above 12, but we're not going to serve a first timer more than 12 on their first pipe. But the handshake and hug doses will generally keep a participant present and aware of self to some degree, to where they'll generally have awareness of their physical body. Will have awareness that they are who they who they are. Have a sense of individual awareness there. Where a full release dose, there's generally less of a awareness of the physical body, and sometimes no awareness of the self either. Um, we find that when working with trauma, it really depends, but very, very often, especially if they're in a sensitive state, especially if this is something we'd like to work into gently, and we don't really believe in the kind of just push them through to a full release. I feel that type of practice is mainly with facilitators who may not fully trust their own skill sets in other modalities, and so may rely on the substance to do the job. But those, low and medium doses can go so much farther when you really, when you combine them with things, and when you utilize them consciously. So someone in a sensitive state, it can be really, really beneficial to start them off on a handshake dose and slowly titrate up. One could even start them off on what can be called a kiss dose, which is, you know, pretty hard to administer out of anything other than a vape pen. But a lot of people criticize going in and titrating up because they say people will not allow themselves to go up to a full release because even in medium doses, this is a super intense experience. And so, it can become more, but there's no need to turn it into a goal oriented thing where they need to get to a full release. We see plenty of full resolutions happen where we never even have to take a participant to a mystical experience. We have plenty of participants who don't even have a pleasant experience on the medicine, where it is all fully tumultuous, deeply challenging, but there's still big, big healing that happens in the following days and weeks. Um, so I think there's a lot of value in the lower doses with 5, and I think that's very underlooked with a lot of practitioners.
I appreciate that. And something you brought up about using the pipe made me remember to ask, what about participants with respiratory issues, asthma? What
Hmm.
I mean, that my
Good
biggest
question.
issue with 5 is just I'm a terrible smoker. I don't smoke a thing. And so like that is the hardest
So
part.
we've got a lot of ways to get there. We mainly work with freebase inhalation, but we have a device that was specifically made for pure 5 MeO-DMT that works in an oxygen-free environment using argon gas, and a device that heats up to the exact vaporizing temperature of pure 5 MEO to produce room temperature vapor. And because pure 5, it's a lot less substance. It's not a bunch of smoke like with Bufo. And so I've worked with that with end of life patients who are on their last few days, who are cancer patients who cannot smoke anything. But even that, let's say that might not be accessible, or just the freebase route just may be a little too intense. There's great routes of administration, such as intranasal, which was pioneered by the late Ralph Metzner, and of course there is rectal administration. One of our amazing colleagues who operates in a retirement community um, who is 80 years old herself and is actually one of the guest teachers in our training program. She strictly operates with rectal administration with suppositories to other people in the retirement area in her community with a lot of success, and has been working with us for decades. And she's amazing. Um, the intranasal and rectal administration, as well as sublingual, but sublingual, you can't do with freebase material. It needs to be HCl. I believe fumarate might be able to work as well, but sublingual as well. Those are much slower onsets, so it's a very gentle unfolding. And generally, people don't go into a full release either. So there's a lot more potency there for therapeutic effects because they'll allow the participant to stay in the layers of their psyche rather than transcending them and kind of cutting right through to an ineffable experience. It can allow them to really be in it. And that slow unfolding kind of allows the nervous system and allows the ego to kind of regulate and adjust bit by bit as the experience unfolds, rather than it being a rocket ship into the central singularity.
I like that description. And also, I love learning new things. Did not know there was rectal 5-MeO. I knew there was
Oh
rectal
yeah, it's
ketamine,
wonderful.
but it's we're just gonna leave that. It's so wonderful. Oh, Joelle, so good. We'll take that at face value.
I'm not only the
Um,
CEO, but a client.
I'm sorry, I'm crying. I swear we can somehow in the same conversation be like, this is totally deadly, also rectal 5-MeO. So thank you for
Yep,
keeping it light. I very much appreciate that. Are there
always.
any conditions that well, by the way, I'm just excited to hear about this other inhalation method that does not require the freebasing, because that I think,
Mhm.
that is kind of like you said, that's kind of intense and can be traumatic in and of itself,
Yeah.
because like I'm always like, did I just fry off my my windpipe? Like it just feels so. Also, yes, a real doctor just said windpipe instead of trachea, but yeah, like I just it's the reason out of practice. But anyway, like, yeah, that is a super intense part of it that is like, oh, like
Mhm.
as you're blasting off, you're like, did I just like do significant damage to myself if you're not used to smoking a thing? So
Exactly.
very, yeah, very grateful for you explaining all these other methods. Joelle, are there any considerations that I have not brought to light here?
Let's see here. I'm sure there are, but that just aren't coming to my head right now. There's a laundry list of medications that we would want to be aware of, either that can risk serotonin syndrome or toxicity, which of course can be fatal. Um, you know, red flags I can think of off the top of the head. Lithium's going to be the one of the bigger red flags there, as there is a risk of seizures there with that contraindication. And then there's a lot of different medications very commonly prescribed for anxiety, for depression, that are going to, there is a risk due to possible competition for the 5-HT1A or 2A receptor. 5-HT1A, there's CYB2T6 inhibitors, there's SSRIs, SNRIs, and they do not automatically um, exclude a participant from being able to work with this medicine. Quite often, if they're able to, if they are in a stable place and have only checked with their primary care physician to see if they're in a stable place to do so, if they're in an okay place to wean off and to taper off at their physician's schedule, and then to have a plan to go back on. Very, very important to have a plan to go back on and taper up as needed, because we don't want to become destabilized during the integration period further than we need to. It's already destabilizing enough. But these many can be proceeded with caution, particularly with dosage, if there's going to be different things competing for the same receptor. And then a lot of other medications are more going to be hints towards um, possible physical or psychological conditions. Whether if they're on an anti-seizure medication or something like that, things like that. But off the top, I'm not thinking of anything.
No, I mean, you thought of drug interactions, and that's absolutely something I
Mhm.
should have asked about. So thank you for bringing that up. A question
Yeah.
as to, do any of those, like you said, they compete for the receptors? Does that mean that they may just have a less intense experience, like, or are they
Yes.
contraindication to take them?
So depends. It depends. And it's different with each medication and how it works, and specifically how it works. But there is a contraindication because, or not really a contraindication, but just caution due to a blunted effect. The question is if there is still a possibility to put them into serotonin syndrome or toxicity by giving them more medicine to try and bring them into a full experience. Um, it's a tricky one. It's always a tricky one with just giving people more medicine. We've found with a lot of medications that do cause inhibition to the receptors that there is usually a difficulty going into a full release. And I've only got theories behind why that is, but theoretically, 5-MeO-DMT is first. It's acting on the 5-HT1A receptor, and then it goes over to the 5-HT2A receptor. The 5-HT2A receptor is what's thought to help induce that mystical experience. Perhaps because there is so much competition, there's just not enough inertia or momentum to get to the 2A receptor. I have no idea, but that is my super amateur theory on that one.
I appreciate your super amateur theory. It works for me.
Yeah,
Joelle, thank you as always. Love having you on. Can you tell people where to find out more about F.I.V.E. and Tandava and all the things you're up to?
absolutely, absolutely. Well, firstly, we'll be at MAPS next month, so see you all there, and we'll have booths for both Tandava and F.I.V.E. You can find Tandava information at tandavaretreats.com, and our flagship center is located here in beautiful Tepoztlan, Mexico, and we work with all different types of containers around 5-MeO-DMT. And then F.I.V.E. is our education and training platform, and the website is 5-meo.education. And you can find all different information on 5-MeO-DMT, all published studies, links to all the different documentaries, all that fun stuff. We're opening up our cohort for our 2024 training. We open that cohort up in 2 weeks, and so we'll be making fun announcements on that. And then just stay tuned. Lots of fun stuff with upcoming research and lots of fun news.
Very cool. I want to specify the website. Is it five the number or F-I-V-E spelled out?
F-I-V-E. Thank you.
Absolutely. Joelle, always a pleasure. Looking forward to seeing you at MAPS
Likewise,
next month
likewise.
and
Thank you, friend.
someday at your
Indeed.
retreat center.
Yes, yes, please.
All right. For everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.